The latest coronavirus update with Dr. Annaliese van Diemen.
We're doing significantly increased testing compared to other states at the moment. So the more we test, the more we will find, and we want to find these individual cases because we want to be able to put that ring around them and make sure that there is no transmission. So the harder we look, the more we will find.
So do you believe that there's similar amounts of cases in New South Wales or even higher?
It wouldn't be appropriate for me to comment on how many cases there may or may not be in New South Wales. I'm very firmly concentrated on what we're doing in Victoria, and that is testing as many people as we possibly can, and trying to really snuff out every possible case in our community.
Public transport's obviously going to be an issue going forward as more people go to work. The union is very keen on people wearing masks in public transport. Is that a good idea? Would you like to see that enforced?
So there is a national expert advisory group of the top infection prevention and control professionals that is advising AHPPC on these matters, and their current advice is that masks are not necessary for all routine users of public transport. Our advice on top of that is for commuters to again be exceedingly vigilant. Please don't take any form of public transport. If you are sick, please be very, very aware of physical distancing, and ensure really good cough and sneeze etiquette if you do happen to be on public transport and need to cough or sneeze. We are working closely with the Department of Transport to ensure that the public health and the infection prevention and control advice is clearly articulated, and they in turn are working very closely with the public transport providers and I believe also the unions to ensure that that advice is able to be implemented as well and as thoroughly as possible. But that's the advice we are working from at the moment, and that's the nationally consistent advice at the moment.
But realistically though, over the next few weeks or month, there are going to be more and more people using public transport. You're going to have to come up, are you not, with some strict guidelines, some strict measures, because we don't want to see what we've seen in public transport in the past, and that's all the people crowded in.
So yeah, we are under no illusions that the way we function as a society, and that includes how we use public transport, will need to change fundamentally, and that this is not an immediate resumption of life as usual or life as it was before COVID, and that's something that's been acknowledged across the world, and that is why we are working very closely with the Department of Transport and providers and unions to look at ways to alter the way that public transport is used and the way those services are provided, and the requirements around the use of those services, including cleaning, including requirements for how people sit, stand, distance themselves on public transport.
Have you provided that advice to the Department of Transport now, and does those decisions now rest with the Department of Transport to come out with those guidelines?
It's not a matter really of us just providing advice and washing our hands of it and saying see you later. We are having ongoing discussions with the Department of Transport. There's meetings and discussions, almost daily at the moment with most departments of the government, actually, about how we're going to move forward in I won't say a post-COVID world because it hasn't gone away, but in a living with COVID world. So this isn't really an ongoing process.